Welcome. I'm going to be explaining the pelvic floor anatomy, and we're going to learn just more about the functions of the pelvic floor and what types of impacts that a not working pelvic floor can have on our system. Anatomy from the outside, we have the pubic bone here, the sacrum here. The pelvic floor attaches from the front to the back. And right here we have the clitoris. Right here is the urethra, vaginal opening, anus. Okay, so the first layer is the superficial layer of the pelvic floor. It kind of forms a little bit of a shelf, like you can see here. It has a function that when it contracts, it creates closure. The second layer is a layer in between this layer and the deep layer, but those are primarily the urethral sphincters. They help create closure around the urethra and can also support their urethra and the neck of the bladder. So looking from the inside, we have the bladder sits here. The bladder's cut away. This is the bottom of the bladder. It's in the front, right by your pubic bone. After that, we've got the vagina, which is the tube structure, and then the cervix, which is the opening to the uterus, and then the uterus would be here. Then back here we have the rectum. And then this whole area is the deep pelvic floor muscles, all of this, okay? So there are muscles that wrap around from the front and they come all the way back and attach into the tailbone region. They also wrap around the rectum, around the vagina, and when this deep muscle contracts, it creates like a lifting contraction. So it's like a pulling up and in, creating stability, okay? So all these layers work together to create stability for the pelvic organs, support for the pelvic organs, stability for our entire trunk system. It's part of the deep core. It contracts with some of our deep abdominal muscles. It works with our diaphragm. It also should be able to relax to allow for sexual function to happen. So any type of penetration, these muscles contract in order to fill and improve blood flow to the clitoris, to allow that tissue to increase blood flow and have a female erection, essentially. And also these muscles need to work well in order for any type of sphincteric function. So in order to not have any type of incontinence, to not lose gas, to not lose urine, to have good bowel movements and not constipation, when you have really tight, deep pelvic floor muscles, it actually will kink the rectum. So it'll create an extra kink in the rectum, and it's very hard to pass stool. So pelvic floor muscles need to be able to both lengthen and contract, okay? We run into problems when it's not doing lengthening and contracting. If it stays tight and it's not able to lengthen, the muscle does not function well. If the muscle is lengthened and not contracting, it does not function well. We need a muscle that can lengthen and contract, okay? So pelvic floor physical therapy, that's what we focus on. We also focus on breathing mechanics, core stability. So that's just a little overview of the pelvic floor, and I think it's also important to mention that the hip and the pelvic floor are so connected, and this model does an amazing job of illustrating that. Back here you can see the tailbone and all of its connections to the pelvic floor muscles, the sacrum here and here, and the deep obturator internus muscle that lives in the pelvic floor. Let's see, this one and this one is an important stabilizer for the hip. That muscle actually is right here. Isn't that crazy? So cool. So the hip and the pelvic floor are connected, and doing a nice detailed examination of all the different layers, how they're functioning, if they're working correctly, is so key in order to helping you fix your problem. Hope this was helpful.